Son las 19 horas en punto de este miércoles 27 de mayo de 2020 y vamos a iniciar la conferencia de prensa diaria sobre la situación de la pandemia de COVID, la pandemia causada por el nuevo coronavirus SARS-CoV-2. Estamos en México, en el Palacio Nacional, en la Ciudad de México. Y hoy vamos a centrarnos en el informe técnico.
Good evening. Today we're going to talk about something that apparently keeps coming up and that requires additional comments. Just as some media and certain aspects of society have been wanting further information, and that is our fatality rate. When we have fatalities, we need their date, their registration, how does that changes the perception that some people may have on how intense the pandemic is. And I would please ask Dr. Alamian if you could present your report. Good evening to you all. Let's begin with this report. This is an update of the pandemic so far on day number 68 of our safe distance campaign. Please just let me remember you that this was a national invitation throughout the country that was looking to reduce the transmission face-to-face on this pandemic and hence reduce the number of cases and also the different cases that might be considered critical at a given point may saturate our hospital availability, which is why through different mediums, we have said that this is a success for us and not necessarily the different interventions that we have had, but also from the answer that we got from our population, meaning those that were following this instruction and abided themselves to this instruction, and that we got these benefits for all as a community. This is our conference number 89, and we update our data now. This is our international data. You can see the fluctuation, it's a minimum number. We continue to be at 24% on the active cases on the pandemic across the world. The percentages, depending on every region, the one that belongs to America, which is ours, has kept the same numbers, with a small increase from yesterday to today in our region, and also noticing that the European continent continues to have lower numbers, and their numbers continue to go down for the past 14 days. Here you can see the numbers updated for Mexico. It's 244,858 people that underwent testing, meaning we had a chance to classify them on suspicious cases, and through this protocol, we were able to test them on a lab testing device so that we can have a good diagnosis. 133,269 resulted negative, and so COVID-19 was discarded, but 78,023 people tested positive, and hence they add to the confirmed cases number, which not only have been cumulated to this number, to this pandemic in Mexico, but we also continue to see every single day that our confirmed numbers, meaning people who have exhibiting symptoms for the past 14 days, which is our longest period that we know so far for incubating the virus, and hence is the time in which the different symptoms may be exhibited. It continues to be about a fifth of our cumulative total, meaning 15,592 are the numbers that are part of the current pandemics today. As of today, unfortunately, we have lost 8,597 people derived from the different complications of COVID-19. On the next slide, we get to see a distribution of our confirmed cases. We are past the number of 78,000 of confirmed cases, and right now we can see on our map in the national territory continues to color itself in darker colors like we did last week. This darker colors continues to represent the largest number of confirmed cases. Yesterday, a fifth state added up. We can say that there are only 5 states that have reached its maximal potential, which is over 3,000 confirmed cases cumulatively of this particular disease. And on the next slide, you can see in descending order the way they are distributed, how these cumulative pandemics can be distributed in the nation from highest to lowest, and the entities that continue to have very little cases. This does not mean that it will be like that from now there on, but their transmission rate and their pandemic's peak will continue to change and might fluctuate in the chart. On the next slide, you will be able to see the confirmed cases in the past 14 days, and hence the active pandemic in Mexico. You can see that the colors here are lighter than the one we saw on the first map, and we only have one state that in its cumulative number for the past 14 days, it's surpassing the 3,000 number, and that is precisely Mexico City that we know right now since today or for the past week. It's basically at its highest transmission peak. Let me show you the next slide where we will appreciate this information in a descending order with the data from every state so that you get to know uh, which are the ones that are having the largest number of confirmed cases for the past 14 days, and we can see them in order. In the next slide, which is our incidence cumulative rate, you can totally make a comparison between the different entities, meaning the different states, because this is calculated on its population total, meaning 100,000 every each 12.2, and it's distributed in the different states as well. This is done in comparison to the people who live in that particular state. This is why it's easier to compare. And it is precisely those states with the darkest green color, the ones that have been having for the past 14 days, on top of the active pandemic, the most cumulative rate of this particular rate. And this is why I'm saying that transmissions have increased and a bigger dissemination of the disease in that particular entity. That will continue to change, as we have said before, just as states continue to go out of their transmission peaks or entering into the peaks as it may apply. The next slide that up to yesterday was only showing green bars, which was cumulative incidence for the past 14 days. It continues to be shown in the green bars, but what we're doing right now, and we're going to be updating it daily, on the gray bar, you will be looking at the same incidence rate, but only for a 1 week period. So as we are looking at the active pandemics in Mexico, we're also seeing the incidence rate for the past 14 days, but also the gray bar will allow us to make a comparison of that same incidence, but for the past week and for the past 14 days. And so we get to see the different changes. Since this is a mobile window that we may be having for the past 14 days, this let us make a comparison on which are the states that are constantly increasing their incidence rate, meaning that they are increasing on the pandemic, and which states that have two similar bars, meaning like the one before and the one from last week, like Quintana Roo, Morelos, Vasco, that they do have parallel bars almost. That means that almost a week ago, your incidence rate was pretty much the same. We are talking about stabilization when this is presented. When we see that the green bar it's lower than the gray bar, which is the one we had last week. We are talking about how last week active cases diminished. That means that it's a state that, in comparison to last week, has actually lowered its activity and its disease transmission. This allows us to see at what stage of the curve they might be, and it makes us think if at a given point we continue to either rise or to low. And so that is visual now to us. And let me give you the example with Quintana Roo, in which I see that the bars are parallel, just like Morelos, that is facing the exact same situation, just like Oaxaca, as well as Tabasco. In Tabasco, even, we can see how the incidence rate for the past week, it's slightly higher than this week. So that tells us that last week, the pandemic curve in Tabasco has been slightly diminished. We will be tracking that every single day to see if this elevation or reduction continues to happen, and if we appreciate a given fall, or if we have reached instability, meaning that they continue to be presented at the same incidence and at the same rate, which is what you get to see on this graph. This will be on our website, on our daily publication, so that you can appreciate it for each single state. My next graph is the fatality rate that we have had, unfortunately, so far. This presents the confirmed cases that had lab positive testing to SARS-CoV-19, which are the blue bars. But we also put in a graph those deaths that have a lab testing pending, meaning that for that particular date, we might have had an increase of number in the number of deaths for this particular date. Further on, we will delve on this graph some other aspects that we have taken into consideration for this particular notification, and how at a given moment correctly interpreted with this graph what the definition is, and so forth. On the next slide, you can see rise highest to lowest, the different distribution of the fatality rate, stating where the states have been having either suspicious deaths or confirmed deaths. And as days go by, when their lab testing has been released, we get to see if they get to join the blue bar, and you can see them in descending order. That tells you what states are concentrating the highest number of deaths. Our next slide is our pandemic curve. We definitely see an increasing trend on this particular curve if we were to add the suspicious cases plus the confirmed cases, and based on the positive percentage that we presented on this past Monday, which was between 40 to 41%, we expect that this light orange color bars, at least 45%, 41% of them will turn into a dark red color, because they would be confirmed if they were to be kept on that level of positive results. Let me show you my next slide, which is our cumulative load. It's a 40.5% increase based on what we had yesterday. 3,463 confirmed cases. That right now, it's important to mention that these 3,463 cases mean just that. Those are positive test results that we got over the course of the past 24 hours. It does not mean that the 3,463 took place in the past 24 hours. That means only that their lab result was confirmed in the past 24 hours, but not that they got sick on the past 24 hours. Their symptom exhibit dates farther apart than yesterday, and now we get to add it on the cumulative rate, and this will change based on the date in which their symptoms were first exhibited. Let me show you my availability on hospitals and beds. This is 39%. This is a graph that you're very familiar with. Please let me show you that today is one of the highest rates we have had so far. It's 98 so far out of the 772 that we had based on our report that closed at midnight last night. And that tells us that they still have 15,091 beds on the IRAG program with bed availability if they were exhibiting important symptoms of this disease. On my next slide, you will appreciate that there is a periodicity on this particular distribution. There are certain states that have a higher availability, and there are some others that continue to have an active pandemic right now, and so they get to have less availability. But even so, for Guerrero and Mexico City, we continue to have a bed availability between 24 and 30%. Please keep in mind that this number may continue to increase and to be better based on our retrofitting process that is taking place in the hospital. Retrofit in this particular case means that beds that were not assigned to COVID-19 patients are now set up so that they can receive these type of patients now. This is a process that we carry out when the levels of availability continue to increase, as we do see that in different states. Now, these particular graphs are for ICU ventilator availability. It's important to bring this number up because this particular type of bed and the material resource, the different personnel that they require, which is highly specialized for them to be operated, they are usually located in an ICU. This is where we get to find these particular types of beds. But facing this pandemic in Mexico, part of our hospital retrofitting has been done for beds that will not have all of the needed elements. They are retrofitted for an ICU unit. They get a ventilator and they get personnel assigned as well as materials so that they can operate. Hence, we get to have more beds to serve critical patients outside of the ICU in the hospital. For those who actually need critical attention, they may be interned and get this attention not only on the ICU, but outside of them. Actually, most of those beds that have been retrofitted for those critical patients are outside of the ICU itself. 35% is our national occupancy right now, which is a level that has been kept stable for the past few weeks. And we do see the states that were being saturated because of this retrofitting. They have been able to take control of this particular equilibrium, and they do continue to have availability for people who require so. That would be my update for today. Thank you very much.
Yo voy a abordar un par de temas
Thank
que
you,
están
Dr.
relacionados
Alomia.
con definitivamente la situación
Let me
más
go over some topics
lamentable de una enfermedad grave
that
como puede ser COVID,
are
que es la
definitely
mortalidad, la pérdida de vidas humanas.
the
Porque
worst
aquí me
scenario
interesa
for a
dejar en claro
COVID-19 disease,
algunos
which is the fatality rate.
temas de interpretación de los números, de tal
I would
suerte
like to
que
be very
ustedes
clear
como sociedad y
on
ustedes
how
como
you should
comunicadores y
interpret
comunicadoras
certain
tengan una
numbers so
idea
that
clara
you,
de lo que
society, and
significan
you,
estos
media
números en
communicators,
términos de
have
estadística, en
a
términos de la
clear
ocurrencia
idea
de la
of
enfermedad en la
what these
población.
numbers represent
Nunca
and what
perdamos
they
de
mean
vista
in
que
terms
detrás de
of the
esto son
incidence
personas,
and of meaning.
que cada persona que
Please,
se pierde
let's never
es una
lose sight that
pérdida
behind these numbers, we're
irreparable
looking at people.
para
Every
la
life
familia, para la sociedad.
that we
Entonces, a
lose,
veces
it's an
los informes
irreplaceable
técnicos
life
son de
for society,
carácter
for
masivo
family.
por la población,
Sometimes
los
in our
concentramos en los
technical
números,
report
pero
that
atrás
get to be
de esos
massive
números
because of
siempre
the
hay
number of
personas.
population we have, then we get to
¿Y por qué
consider
lo
the
explico?
numbers,
Porque hoy
but
fue el
behind
motivo
those
de
numbers,
atención
there
de
are
algunos de
always
los diarios
people.
nacionales.
What I would like to explain,
Es
because it
la
was brought to my
cantidad de
attention based on
personas
some
que
international
ayer
press,
informamos, 501,
it's
han
the
perdido la vida.
number of people
De
that we
forma
reported yesterday,
aparentemente
which was
reciente, según las
501,
propias
who
notas,
have
y
unfortunately
destacaba,
passed away.
aquí algunas de ustedes me lo comentaron, el día
According to
de
our own
mayor
notes, this was
ocurrencia de
basically
mortalidad, lo cual
recently,
es
and
una
some of you
visión
actually brought it up. It
entendible,
was the
legítima,
day we
respecto
got
a
the
que
highest
pronto recibí la
death rate
noticia de
yesterday,
501
which is completely
muertes.
understandable because
Lo
you
que
actually you're
consideramos que
sometimes just hit with the
cuando hay
number of
una confusión sobre algo
501
que se ha
deaths.
informado, siempre partimos del principio de que es
When
nuestra
there's a confusion
responsabilidad
of something that has been
trabajar por ser
informed,
más
we
elocuentes y resolver la
always
duda.
say that it's our
Y eso es lo
responsibility
que
to
queremos hacer hoy.
work on clarity
En esta
and
gráfica,
resolve
que
your
es
questions. And that's
semejante,
what we
de
want to
hecho es
do
la misma que acaba de
today.
presentar el doctor Alomía y que es la que presentamos todos los días con un color
This
azul
graph,
y un
which
poco
is
de
the
color
exact same
amarillo,
one that Dr.
donde
Alomia
ponemos el número
presented
de
and the
muertes
one that we present
acumuladas
every
por
single
COVID
day with blue, and
Es la
yellow,
misma
when
gráfica,
we
solo
place
que
the
le hemos
number
cambiado
of
colores
cumulative
para
deaths for
ilustrar
COVID-19, it's the
exactamente
exact
la
same graph, but we
diferencia
only switch the
entre la
colors
fecha
around
de registro
so that
y por
we
lo
can
tanto
depict properly
comunicación
the
del
difference
número de
between
muertes
the
con
registration
la
date
fecha de
and hence
ocurrencia de estas
the
muertes.
number
El
of
mensaje
death rate
principal, perdóname,
communicated
lo
with
explicaré
the date in
frente a
which
la
it actually
gráfica,
happened. My
es
main
nosotros
message
cuando
is, and I
recibimos
will
la
explain this
información,
further in
recuerden que
front
toda
of
esta
the graph,
información proviene
is that
de los
when we
estados.
get the
El gobierno
information,
federal
please
no
bear
genera
in mind that
información
this
sobre la
information
situación
comes
de
in
COVID.
from the different
La
states.
responsabilidad
The
del gobierno
federal
federal, de
government
acuerdo a la
does
ley,
not
de acuerdo a la ley
generate
oficial mexicana
a number
para la
on
vigilancia epidemiológica, la
COVID-19,
017, es
but based on
integrar,
the Mexican
analizar,
law
interpretar y
for
comunicar
the
la información
017 rule
de la
for
vigilancia
pandemic
epidemiológica.
surveillance
Pero se
is
genera
to
con las
analyze,
entidades
get, and
federativas.
communicate the
En el
numbers
momento en que
of this
nosotros
particular
recibimos la
pandemic,
información,
but it's generated within the
tanto de
state.
casos como de
When we
hospitalizaciones,
receive
como
all of
de
that
las muy
information,
lamentables defunciones,
both from cases,
las integramos a la
admissions,
estadística que
and the
presentamos todos los
unfortunately
días y
death,
la comunicamos en tiempo real.
we
Como
both
el ejemplo de ayer,
integrate that
ayer
to our
tuvimos
daily
esta
statistics and we
suma de
communicate it on a
notificaciones,
daily basis,
501,
like the one
y
we
fue
had
momento de
yesterday.
presentarla como lo hemos hecho todos los
We
días.
added up a total of
Sin embargo, es
501. It
importante
was our
para no
moment to present it
interpretarlo
just like it was every
en el
single day.
sentido de que ayer fue
Yet,
el
I
día
think it's
con la
important
mayor
that
intensidad de
for you
mortalidad,
not to interpret
lo que
that
natural
yesterday was the highest
mente llevaría a
death
pensar que la
rate
epidemia
intensity,
ayer fue aún
which
más
will
grave que
naturally
anteayer
lead
y
you
que el
to
día
believe
previo y
that
que
the
la semana
pandemic
anterior, cosa
was
que
at its
afortunadamente
highest
no es cierta.
compared to yesterday,
La
the day
razón de
before
esa
yesterday, or the past week,
situación
which is
es que se
unfortunately
acumularon los
not
datos
true.
por distintas razones, mencionaré algunas de
The
ellas,
reason for that
y
number is
nosotros al
that we
recibirlo,
got
en el
cumulative
esquema que
numbers,
tenemos de comunicación en tiempo
and
real,
when we
pues
receive
lo
them
traemos y lo
within
comunicamos.
the
Antes
communications
de
team that we
tomar la
have,
gráfica,
which is a
les
live
explico cómo es el
communication,
proceso de
we show it up
notificación de
and
la
just communicated it.
mortalidad o de las muertes por COVID.
Before I explain the graph, let me
Básicamente,
explain you
cuando ocurre
how
una
we
defunción
notify
por
these
COVID
numbers,
en las unidades
specifically
hospitalarias
for
donde ocurre
COVID-19 death.
la
So
muerte,
whenever someone
o incluso si
unfortunately
ocurriera
passes
fuera
away
de
for
unidades
COVID-19,
hospitalarias, en el
the
domicilio,
hospital unit
la persona que
where that
fallece
happens, or
debe
even
ser
if they pass
certificada.
away
Se
at
debe
their own
emitir un
home,
certificado de defunción.
the
El
person
certificado
who
es un
passes
documento
away must
de
get
carácter
their
legal,
death
gratuito,
certificate,
por cierto.
which is
Aquí
a
aprovecho para
document
recordarle a todo el
that
público
holds
que todos los trámites
legal,
del certificado de
that
defunción
bears
son
legal
gratuitos.
value. And
Nadie debe cobrar
let me
por
just take this
certificar
opportunity to
una
remind you that this is a
situación
free service.
final.
No one should be charging you
Entonces, la persona que
to give
certifica,
you
que
a death
habitualmente es un
certificate.
profesional de la salud, concretamente un médico o una
So
médica
the
con una
person who certifies this
cédula
is
profesional,
usually a doctor
debe poner las causas de muerte y
with
entre
a
estas
professional
causas de
license to
muerte
practice.
deben
They
ponerse
should
en
list
el orden
the
en que las
reasons
causas
for
fueron
them
llegando al
passing.
desenlace
And
final,
within these particular
empezando
reasons
por la
were
vista
listed,
con
they
la
should
que de
be
manera más
done in the
inmediata
way they
llegó
will
a la
present it
pérdida de
first and
vida,
how they
por ejemplo,
got to
insuficiencia
their
respiratoria.
passing away. Meaning they
Seguida
should be
de
listing
las
the
causas
reason
que
they
llevaron
passed
a
away
esa causa muerte.
immediately, like unable
Y
to
en el
breathe,
último renglón
and
del
follow up
certificado de defunción,
with
que tiene
following
4
up with what
espacios,
are the causes
para
that
tales
might have
causas
led to that
viene lo que
particular
se llama
situation.
causa básica
And
de la
there
muerte.
are 4 spaces to
Si
enlist
se trata de una persona
those
que
those aspects, and
padecía
there
los
is a
síntomas de
particular
COVID,
rubric
COVID
that
grave,
says basic cause of
gravemente,
death.
y
Let's say
que
that there's
se le puede
someone who
tomar
was
una muestra de
exhibiting
secreciones
critical
respiratorias
COVID
para
symptoms and
diagnóstico
they got to
por
be tested
laboratorio. Lo
on their
deseable
airway
es
so that we
tener el
could have
resultado
lab
antes
testing
de que
done on
fallezca
it.
la persona.
What
Evidentemente,
would be
siempre deseable
ideal
que no
is that
fallezca,
we got the
pero
result
desafortunadamente
before the
puede
person
fallecer,
passed away. Of
pero puede
course,
ser
we're
que
always
está
wishing they
hospitalizada la
don't,
persona
but
y durante el
unfortunately, this
curso de
could
su
happen.
hospitalización llega el
The
resultado
person may be in the
y generalmente
hospital,
se
and
procesa
during
en
his
24,
hospitalization
48, a veces
process, they get
72
the
horas
result.
el
It's usually
procesamiento
processed within
laboratorio,
24 or
y si
48 or
llegara a
even
fallecer la
72
persona,
hours,
se registra
the lab testing
COVID
procedure itself.
o
And if the
infección por
person were to
SARS-CoV-2
pass
como la
away
causa
in
básica
the
de muerte.
meantime, we would write
Segunda
down
posibilidad
we would
es
write
que
down COVID-19
desafortunadamente la
or
persona fallezca,
SARS-CoV-2
pero sí se le tomó una muestra
disease.
útil
The
para
second
diagnóstico
scenario
por
would be that the
laboratorio,
person would
y al
pass
momento en que
away.
fallece la
Well, we
persona
did get to
no se
test them
conoce todavía el
properly,
resultado del laboratorio,
and when they pass
pero
away,
el certificado hay que
we
emitirlo de manera
do
inmediata.
not have the
Entonces
final lab
corresponde
testing results,
poner
but
en
we do
causa
have to give
probable
out
COVID.
the death certificate right away.
Recordarán que hace algunas
So it
semanas
would be
presentamos
probable
aquí la
to write down that they had COVID-19. A couple of weeks ago, we show you the guidelines that it's available to all public towards the right way to fill out the death certificate formula, that it's abided by the International Center of Disease Classification, that it's coordinated by the WHO. A third scenario, that in these particular times where we're having a lot of cases, which is phase 3 for us right now, the person may reach the hospital too late and they just pass away as soon as they reach the hospital, or even before, while in the ambulance or in the car, or even before at home. Let me remind you that COVID-19 can be lethal and can just catch us out of guard at any given time. So anyone with diabetes, hypertension, obesity, smoking problems, or any other situations that might suppress your immune system, or that you might be pregnant, or you are over 60 years old, or any person who may even have someone directly related to them with diabetes or hypertension, they should consider themselves with a higher risk or of vulnerability towards COVID-19. So if you were to exhibit the symptoms for COVID-19, fever, sore throat, reddening in your eyes, in your nose, fatigue, and others, you should resort to medical attention to evaluate if you are turning your symptoms into COVID-19 symptoms. Our purpose is that you are not relaxed about this topic. It is for us to have the proper attention at hospital using non-invasive oxygenation processes with a mask that may be successful and save your life. So I just want to say that people are afraid that they may go to the hospital because they are under the belief that going to the hospital may kill them. That's extremely sad because I understand that the feeling is legitimate, but it's based on lack of information. Reaching to the hospital cannot produce that. Getting to the hospital allows you to be treated properly, get the different exams that you need, like an x-ray from your thorax and whatnot, and attention with non-invasive oxygenation for a couple of days. And that can take a difference between them needing general hospitalization or the person requiring, which we do not want, but maybe they do need to be intubated and have a ventilator, or even worse, they pass away. Now, if I can remind you, the person might not have been tested, and our surveillance mode still takes into account that even the person after they pass away, they can immediately be taking a test so that we can know. But it's also understandable that when they are there with a large number of patients, it might be a bit complex to do it. And I think that's understandable. They should prioritize people who are waiting and not necessarily that we get testing, that while it is important, it might not surpass the need to serve other people in a higher risk. And with this said, a couple of weeks ago, we said that people may have died without testing. And again, our correct guideline for filling out the death certificate form, it forces the doctor filling out that particular form, COVID or probable COVID-19, based on the international classification that I mentioned before. At that particular moment, that's extremely useful because it will allow us that through the death certificate, we can incorporate the different statistics of the fatality rates that are not feasible to have on a live format. I think we've spoken about this before. And they were asking if we were more cases or if there was conflicting data between what the states were saying, and that's the way we do it.
And I would like to reiterate what Dr. Sheinbaum said the last time she was here. We will disclose the outcomes because they're of the utmost importance. We will bring them here, we will talk about them, we will discuss them. The technical commission, Dr. Sheinbaum mentioned, is currently meeting. They're analyzing death certificates, mortality records, and we're also meeting with them and both the federal and the Mexico City governments. Let's get back to the chart. As you can see in red, and just as a friendly reminder, the horizontal axis is time, a period of time since March 18, when the first death was reported, to date, well, May 26 yesterday, the column in blue. This is the number of events in this case, the number of deaths, 50, 100, 150, 200, 250. It's the maximum height of the bars. The day of the higher amount of deaths, we reached 150 deceased patients, and it took place on May 15. It was the day of maximum mortality. May 15, the blue bar here. So then, why is it that on a daily basis we show up here and we give you figures that may differ from what you've seen before? Because right now it says deaths according to date of registry or the date they were entered in the database. Isn't this, Jose Luis? This is date of occurrence? Yes, and when I say occurrence, it means that it follows the date on which it took place. And as you all know, this chart is being updated on a daily basis. This is the curve of fatalities in red, and we broke it down into additional intervals. In red, you will find all deaths that took place before May 19th. This is May 18, and after May 18th, there's no longer a red bar because those bars in red took place before May 19th. In like beige or light brown, you will find the deaths between May 19 and 25. This is why it says May 25 here. And we don't have anything in that same color by May 26. So I'm talking about all these deaths, okay? April 11 is where there were deaths, like you can see, and it leads us up to May 26. Those bars in blue account for the 501 deaths we reported yesterday. This is why I broke them down right now to convey this concept, because these deaths were reported or notified on May 26, and they add up to 501, okay? But take a look at this, because this is the key message. They did not all take place on May 26. They took place on May 24, 23, 22. The earliest death reported yesterday took place on April 21st. One death on April 21st, and most of them took place in the past 7 days, in the past week. So that's why I want to bring to your attention that, these deaths are being reported by the states. They're reported by the states on a daily basis. And it's because perhaps the patient was already reported as a hospitalized patient or as a deceased patient, but they had not been entered yet into the platform because they were awaiting the lab test confirmation. Okay, let's take a look at the next chart. Okay, these are the deaths. These are the 501 deaths reported yesterday. Okay, here they are. We have one on April 11. We have several more. Most of them took place in the past week. The most intense day was May 24, when 79 people passed away. It was important for you to know. It was important for society to know. No hard feelings for the media who took the opportunity to write down on their headlines that 501 people had died on that very day. Okay, that did not happen. It was the cumulative number of cases. Let me go to the statistics, okay? Statistics remain open and active. Why do statistics remain active? Because if we were to close down the data and we started to analyze the deaths, the known deaths and all the reported deaths, let's say we enter them today. But what if tomorrow we find out about a death or somebody who passed away in a different city last week? We have to add those people. We have to enter the data about those patients. So as soon as we get the information, the data is entered, okay? And we do update the proper date. So we communicate, we convey that message to you on the day we find out about it, but we do enter the right information and the right date of death of a given patient, okay? So these are the deaths notified or reported on May 25, but this is the date we found out about those deaths, okay? On May 15, we only knew about 4 deaths, okay? This was the number of deaths to our knowledge by May 15. By May 16, this was our knowledge of the number of deaths by then. On May 17, this is the number of deaths we knew about, okay? And they all add up, the 48 includes the 4 and 85 includes the 48. So we add them up. That's why it's a cumulative statistics. And we came up to 501 deaths by yesterday, okay? I wanted to explain the surveillance process to you. I wanted to explain how fatalities are recorded. So that's what we wanted to let you know. We're going to start with Saturnino, Araceli, and Olinka. Hello, I'm Saturnino Reyes from El Locutor Journal. I think this is a mandatory question because the president mentioned that it is likely that on June the 2nd, he will start his rounds throughout the country. Is he aware of the risk? And what's the purpose of the rounds or the visits he wants to pay to the different entities of the country? Because he is the head of the country. He has to set an example to Mexicans. So if he leaves his house, everybody's going to leave their house or everybody's going to want to do the same thing because everybody needs to go out, we need to go out to work. So what will be the measures that the president will take, or how are you going to mitigate any risks? Because right now, nobody should go out, although on May 30, the safe distance campaign will end, but the stoplight will remain in red. So my advice to the president is stay at home. We all want to leave. And as you mentioned, our role as journalists is to inform and to report the truth and the necessary measures that society and all citizens should be taken. So I would like you to clarify, not only to us in front of you, but I would like you to explain what the president is going to do to the whole country. And I would also like to know, I would like you to tell us what happened in your meeting with the upper house. Thank you very much. And you know what? I had to talk to you about the difference between fatality and mortality, okay? And so I didn't share 2 slides of my presentation, the presentation I had prepared for you today, but I will get to address that later on. Let me answer your questions. Why must the president of Mexico leave his house and go to work? I'm going to share with you our real-time discussions when the cabinet meets. Tomorrow, Thursday, we will meet at 8 p.m. Okay, it's a routine meeting. It's a COVID-19 follow-up meeting. And what he wanted was to devote specific time to think it through, because he wanted scientific information and medical advice as to decide if he should go out or not. And, this is how things happen. We meet at closed doors, we meet and he asks for our advice, he asks the physicians, the medical team, the experts, their opinion. So why must the president of Mexico go out to visit the country? Well, because all activities are important. The country's activities are important. And it is important to reactivate Mexico's economy. That's why we're getting ready for the new normal. And today, in our meeting with the senators, we discussed once again the difficult balance between protecting life, protecting the citizens through safe distancing, and the well-being of the economy. And we're not really thinking of the economy in terms of, in literal terms as what economy does, but we're thinking about the most vulnerable economies in the country, persons who just make it through the day. So if COVID was our only problem, of course, the whole purpose or the whole point would to remain at home, confined for months or for years. Okay, if that were the country's or the planet's only problem. But, we need to ensure that all citizens barely making it through the day that they have a way to make it. It's no fantasy. It would be great for us to find a document claiming, okay, by this date you can go out. But no, that's not the way it works. I think all national governments are right now trying to test how it works when safe distancing ends, or they're trying to work out ways to go back to normal or to embrace the new normal, okay, by reducing the number of mass events, reducing public mobility, you know, that's what we're doing, and that's what Mexico is going to start doing. That's why we have the risk stoplight. So we will have just one risk stoplight at federal level, but we will remain in touch with the different federal entities. So let's get back to the president. Of course, the president is on top of the mat, and there are different government activities that had been scheduled, and they were put off, some of them, but they can no longer remain on hold because our economy must reactivate. Of course, nor the president, nor his technical advisors believe that he has superpowers or something like that. Nobody believes that he has any type of privilege whatsoever because he is the country's leader. We are thinking about him in terms of his public usefulness, okay? And this decision is not final, okay? That, as he said, so the decision has not been made yet. That's why we're going to meet on Thursday. He was acquainted with the risk stoplight methodology, and we had another meeting with the governors yesterday. We showed him the information. We talked about the risk stoplight, and he summoned us on Thursday to discuss all these affairs and to make a final decision. Of course, the government activity is an essential activity, and not it only as pertains to the president, but it also involves the governors, the mayors. But the whole purpose of this was to reduce the massive amount of people who are working. Right now, the government is in standby. Nobody's going to work. Although we are providing the most important, we're providing the key public services to ensure human rights. So we'll review the topic tomorrow, and I'm sure that the president will notify his decision on Friday. Now, I would like to tell you that if he decides that he will start to travel, that he will start his rounds throughout the country, he's not going to go to stadiums for mass reunions or mass congregations. He established a limit for his own activities. We would have advised them as well. And he said, okay, 40 individuals meeting in aired spaces or enclosed spaces. And he asked that everybody should understand that this is a very special moment, that this is a key moment, and nobody should approach him, nobody should approach his delegation, and people should also maintain self-distance between them because we must avoid public concentration. So if he does go out, if he travels throughout the country, we will follow the epidemiological curve, in a controlled fashion and by implementing additional measures to safeguard the president's well-being and health. I'm aware it's 7:48 p.m. and I will address the last two slides that I had prepared for you, okay? The difference between mortality and lethality, okay? Mexico is the country with the highest lethality, 10%, almost 11%. In our conversation with the senators of the Political Coordination Board, we discussed this, significantly. There was a significant discussion, and I will share that discussion with you today. Definitions: mortality and lethality. The Royal Academy of the Spanish language doesn't use technical details to describe a certain meaning, okay? So you will find basically the same definition between mortality and lethality, okay? It's just like trying to find bunny and rabbit. So, from the technical perspective, in the epidemiological dictionary, there is a subtle yet relevant element. Mortality is a consequence or the impact of a fatal event, of a fatality or a disease as it regards a certain given population of a country, continent, or the entire world. That's mortality. So we're interpreting the impact of what I'm analyzing on society, okay? And you can compare proportions or mortality rates, mortality due to cancer as compared to the influenza mortality rate, or COVID-19 compared to diabetes death rate. You know, you can also make comparisons between age groups, between genders, you know, indigenous population, non-indigenous population, X, Y, Z. That's what mortality is. Now, lethality is the number of people who have died as regards, so mathematically it's a division, okay, as regards the number of people who had a disease that caused death. Okay, so mortality, COVID mortality, it's the number of deaths divided into the number of the population, okay? And we take that from the census. Now, COVID mortality, number of COVID deaths divided into the number of COVID patients, okay? So it's a much smaller number. Lethality, as we've mentioned before, cannot be compared from country to country. Why? Because different countries have different epidemiological surveillance approaches. Countries do things differently, and they prioritize those aspects that will help them in their decision-making processes. Today, in our conversation with the members of the upper house, we discussed that there's no country in the world capable of recording every single COVID-19 case. Okay, let's say there's a country with 1.5 million reported cases and they're running 7 million tests with a national population of 350 million. Okay, so they only reported 1.5, whereas they probably have 12 million cases, unreported cases. So it's impossible to count. There's not even any point in counting the number of cases because it's not useful. It's really slow. It's a burden. And it really prevents you from making quick, expedite decisions. And you know, the Mexican government from the early days decided to do only what was possible to do, okay, and not to focus on what was impossible or unnecessary. And I would like to say something else. The number in this division, okay, the denominator, which is the number of COVID cases, we know this and we've stressed this in Mexico and all over the world. This number is lower than the number of existing cases because we've been able to control this pandemic because the elderly population, patients or people with chronic diseases have stayed at home, you know, even if they have mild symptoms of their chronic disease. Same thing to about pregnant women. Most of them have stayed at home. And
que sí tenga complicaciones o que sí tenga alto riesgo de complicarse.
we don't want
Y no queremos que eso pase.
complications. We're trying to prevent
Todos
complications,
tienen
and we're
derecho a
trying to
atención
provide
de salud.
broad healthcare coverage. But from the medical perspective, it's really important for you to know that if there's a patient with complications, that person needs to go to the ER and to the ICU right away, because if we have a different case without symptoms, they can stay at home. So it's a great contradiction if the sanitary authorities of different countries say, okay, I'm counting every single case, and don't go to the hospital, stay at home. We respect other countries' decisions, but our actions are in agreement with science and transparency. Now let's talk about the consequences of lethality. In this division, the denominator, if it is a lower number, you will get, as a result, you will get a higher number, which is exactly what overestimating means. Okay, I read a newspaper this morning and I saw a picture of the president and I saw a picture of another public official, me, and they're saying that he was claiming that we're the country with the highest mortality, and I was talking about lethality. No, we were both saying the same thing, but things were interpreted in opposite ways. So I do hope that you understand what I'm saying properly. So El Heraldo showed this chart claiming I had shared it with you yesterday, but you know what? No, I didn't do that. I didn't share with you this slide, okay? And here it is. Compare the lethality between Mexico and other countries. The source of this data is the WHO. By the way, Johns Hopkins does not produce, it does not generate information. It just compiles information generated by other entities. So we have the different regions of the world in this chart. Okay, we have America, Europe, Western Pacific, and Southeastern Asia. America is the region with the highest lethality, okay? 10.9. And yes, in terms of lethality, it is the highest, but it just explained. This is an overestimation, okay? What's the actual figure? We don't know it right now, but it's not relevant at all because we've been following the same exact methodology when we can track the figures down. Although the WHO knows it, and we also know that it's not an appropriate way to compare figures between countries because every country has its own methodology. The Mexican government is explaining every single thing to the population. I don't know if other countries are doing that. Okay, now let's take a look at mortality. There's no issues with the denominators when it comes to mortality, okay? Because census and data reported by census generally have the same information, okay? So right now, this is the compared mortality, same region, same colors. So where's Mexico now? Here it is, 5.6. And we still have the same number of deaths reported yesterday, over 7,000. So are we number one in the continent? No, we're not. And we are using a rate that allows a more appropriate way to compare data between countries. Okay, so this is part of the explanation you all deserved. Go ahead, please. All right, what was your second question? I think that we should give another reporter a chance and to ask, and then I'll get back to you. The meeting with the Senate took 6 hours. Hello, I come from Querétaro. And I would like to ask you how patients are cared for in the hospital. Intensive physical therapy aims at stabilizing patients, by preventing pulmonary capacity, by preventing any distress in pulmonary capacity, by acting in the right way with the patient as to expand the number of days with mechanical ventilators. That may also increase the days of stay. And I would also like to know what you're doing in terms of follow-up, because when patients are released from the hospital, they have pulmonary distress, they have a pulmonary failure. So my question is, why haven't physical therapists been taken into account to assist the patients? And I would like to know if you are working or you have contemplated pulmonary rehabilitation, because of course the patients are going to require pulmonary rehabilitation. Because, you know, I was browsing the Ministry of Health's website and there was not even a tab related to physical therapy. Are you a physical therapist, a pulmonary physical therapist? I'm here. Yes, I am, and I'm here. So welcome and thank you for joining us, because you're an expert and your opinion is key, because broadly speaking, there's been underinvestment in the national healthcare system, and we're looking for physicians, we're looking for healthcare professionals. The medical institutions are trying to recruit staff, and there are fields where we don't have sufficient staff, you know, like in intensive physical rehabilitation and intensive physical therapy. We need professionals. So if you are out of employment and you are a physical therapist, you should apply for a job with the health ministry. Olinka, we will leave your question for tomorrow because it's 8:01. Let me say that I was summoned by the political board of the Senate. They were there, everybody was remotely gathered, and I was questioned about the COVID-19 epidemic and how we've managed the situation in Mexico. I shared publicly disclosed information, and I do believe it was a constructive dialogue. I believe in the three branches of government. I believe that everybody should be questioned, everybody should have the opportunity to disclose a strategy, and everybody should ask public officials about what they're doing. So we talked about mortality, we talked about lethality, we talked about the new normal, if we're ready, if we're prepared or not, and we also discussed all things lab tests. So, you know, I decided to come back on one of these days and talk about lab tests, okay? A technical guide was published in the USA Today, and it says that 50% of serological tests come out with errors, okay, or with false negatives. So that's the current status, that's the current situation of serological tests and fast tests, okay? No, serological tests are not PCR tests, okay? It's antibody detection and blood tests, okay? Thank you. 8:03 p.m.